About 1 week until the start of school for many districts in our state. We're seeing coronavirus cases skyrocket to the highest they've been since February. Since Friday, more than 5,500 Oklahomans have been diagnosed with COVID-19. Our 7-day average at nearly 1,600 new cases a day. Oklahoma is now in the top 10, by the way, for new coronavirus cases in the past week.
It's not the top 10 we want to be. Joining us to talk about this troubling trend this morning is OU Health Chief COVID Officer, Dr. Dale Bratzler. You can see Dr. Bratzler joining us in studio this morning. Dr. Bratzler, appreciate you being here.
Yeah, my pleasure.
Let's start with these numbers. I mean, folks have a lot of opinions on masks, on vaccine, but it is difficult to argue with the facts. Our numbers are going up at a very, very high rate. What do you make of it?
Yeah, we've seen the number of new cases a day in Oklahoma double in the past 10 days, more than 1,600 cases a day right now. And hospitalizations have gone up considerably also, 739 people in the hospital as of yesterday. So we have some real concern right now.
Doctor, we were all hoping we could kiss those masks goodbye like we thought maybe a few months ago we were going to be able to. What are the recommendations right now? We're back to a mask mandate here in our building for folks that even have been vaccinated.
Yeah, absolutely. I think with the Delta virus, which is highly contagious, and we now know it can infect people who are fully vaccinated, and those people can actually spread the virus. It's very prudent to wear a mask anytime you're in an indoor setting right now.
Let's talk about hospital capacity. We know our hospitals are full of the unvaccinated. 98% of those getting hospital treatment have not had a vaccine, and our hospitals are filling up. I think Dr. George Monk said yesterday there were no ICU beds left in the state of Oklahoma. What are you hearing from your colleagues in hospitals around the state? Yeah,
so we had a conversation last night. There are hospital beds. Part of the real problem we're dealing with right now is a nursing shortage. So even though we have beds that we could potentially open up, we don't have enough nurses to staff all those beds because we saw so much attrition during the real peak of the pandemic in, January and February.
Can't help but think we're going to see that same attrition again. We're hearing from so many people in the healthcare industry who are exhausted.
Burnout.
Absolutely.
Yeah, for sure. Well, school is getting ready to start. There's a lot of talk at the Capitol about, we passed this Senate bill that says you cannot mandate masks in schools right now. A lot of schools are concerned about that ban, if you will, on masks, and some folks are calling for the legislature to come back and maybe change that rule. How do you feel about it?
Well, so let's look at the reality. Kids below the age of 12 can't be vaccinated. Even if you look at the 12 to 17 year age group in schools that can be vaccinated, only about 14 to 15% are fully vaccinated. So we have a highly contagious variant. We're going to bring students together that mostly aren't vaccinated, indoor settings. The chance that the virus spreads is quite high. And so masks are one of the most effective ways we have to prevent the spread of the virus.
The bottom line is you do what's best for your own kids, and as a parent, you were always able to send your child to school with a mask.
Absolutely.
By the way, very quickly, how soon do you think we might reach some herd immunity in Oklahoma? And are you worried about this variant once again mutating?
Yeah, so we always worry about variants mutating. I'm more worried about maybe an Indonesia variant or another variant that comes out somewhere else in the world that then comes into the United States. Most of our models right now show that we may peak with this Delta variant somewhere late September, October, in that neighborhood. So we'll have to wait and see what happens, but it's spreading very rapidly.
Dr. Dale Bratzler joining us in studio from a distance this morning. Appreciate you making the trip in.
Yeah, sure do. Thank you so much, Doctor.
My pleasure.